Yahweh, my name is Morda Netwon. I've been living in the United States for 24 years now. It's about insurance. You don't have to have medical, dental, or vision insurance in the Marshall Island, and you don't need them, not like here in the state. All you have to do is pay $5 and then you can be seen. That $5 will cover your visit along with your medication if you're prescribed medication. So it's not like here in the state, and you can see a reason why quite a few Marshallese don't understand how to use insurance, or we don't have insurance because we don't understand all of that copay and deductible and all of that. Okay, I will bring up the time that I have my youngest child. I have three older than my youngest. And with the older three, I never had any luck with breastfeeding. So I remember when I used to go to my prenatal visit, I will be asked by my doctor and nurses, what are my plans after I have my child? So I told them that I would like to try both bottle and press. So I remember after I had my baby, I think they make sure that they send in a nurse, a coaching nursing person, so that person could actually sit down with me and show me how to do it instead of just tell me, well, this is how you do it. The person actually spent like 30 minutes each time just to really show me how to do it. So I was able to do both things for 1 year. So I really appreciate that. I don't like it when they send in their student without notifying, or at least give me, as a courtesy, tell me that, well, we're going to bring in these students. And that has happened to me several times. I feel like I'm being experimented. I feel like I am a guinea pig with all that testing that has been happening in the Marshall Island. I feel like quite of us feel that same way. So I don't appreciate when they just bring in students without even letting you know. I would like them to know that we are reserved and private people. We wouldn't just come in and just open up and say what we're in there for. So I think they need to understand where we're coming from. It's not like we're not cooperating with these doctors and nurses, but we would like to have small talks, and then we'll be able to open up and really communicate well with the doctor. Just just how is your day? Or one thing that I noticed that works in the clinic, all these students are learning like very basic work, like Yahweh. That could open up a channel of communication. You feel you're welcome. If I'm in an appointment and I have maybe a family member or a male relatives right there, I wouldn't want them to ask me personal information like health, something that is related to my health, especially when there's a male person there. I would rather that they ask me first if it's okay to discuss my woman's health in front of these male other people next. I mean, right there in the room, because it's culturally inappropriate. Same thing with a male. If it's a male patient, maybe ask them first, do these people need to be here before we discuss your health, or do I need to pull them out? If they see me bringing several people, there's a reason why I'm bringing those people, because I need, I mean, support. So if allowable, maybe let me take one person back into the exam room. Sometimes we need them. There are people that bring in family member for so they can interpret for the patient, and sometimes it's just to I think we like to come in groups for support, especially if we're not back on the island. We feel kind of uncomfortable, especially if it's a new clinic or a hospital that we're going into, not knowing if you're going to have an interpreter or just to bring that person in for support. I can say it's a plus if they can hire interpreter and CHW, because those GHW community health worker, they understand the culture, so they can to the side talk to the doctor and say, hey, this is so and so. They're not. There might be some misunderstanding, like why are they not coming into their appointment? Why are they canceling? Why did they wait up until this moment? There might be other reason why. So those CHW understand those kind of things.